Now, what about stress? What do we mean by stress that's relevant to bipolar disorder? Here are some of the stressors that have been linked to changes in bipolar mood swings in the research literature. Certainly loss events, death of a loved one, an illness, severe illness, death of a pet has been known to trigger symptoms. Huge conflict with a spouse or a parent seems to be also a trigger for some people. Criticism from parents. Needless to say, criticism is something that comes from parents. There's no two ways about it. All of us experience criticism from our parents, but people with bipolar disorder, schizophrenia, other illnesses are particularly sensitive to judgmental statements, pick it up with tone of voice, and it does have an effect on their moods. Parenting problems, sometimes if the person is also a parent themselves, they have difficulty separating out what they should or shouldn't do for their children. Constantly changing work hours. One of the worst jobs for someone with bipolar disorder is to be a happy hour waitress, because you're constantly changing work hours, there are bursts of stimulation, there are downtimes, uptimes. I'm from Los Angeles. Everyone there is an actor or an actress. Not a great job if you have bipolar disorder because of the constantly changing demands. Sudden increases in job demands, or the stress of finals for college students. You see people showing up more and more in student health services at those times. But it's very important for people to know, what is it that are my stressors? Importantly is for people to know that this disorder, while it resides in the brain, and we have no doubt that these are disorders that go along with certain irregularities in neural transmission, or we know that these disorders are inherited. We know they run in families. We don't always know what is inherited, but we do know there are biochemical abnormalities that these medications are meant to correct. We also know, though, that stress plays an enormous role in triggering episodes. That's one of the reasons it's important to have psychotherapy as well as medication. How many of you do meditation? How many of you would like to try a medication exercise right now? Well, we got 3. Let's try it. This is something we do a lot with our clients to try to help people learn to manage their own stress, and it's going to take literally 3 minutes, maybe 5. So I'd like everybody to sit comfortably in your chair with your feet straight on the floor. You can either close your eyes or stare fixedly, if you want, at some object in the room. Your shoes, the slide if you want, anything you like. Close your eyes. For the next 60 seconds, be aware of noises in the room. Be aware of the sound of my voice. Maybe you can hear the hum of the air conditioner, other people coughing perhaps. Acknowledge each sound you're hearing, each thought or feeling that goes through your head, whether it's pleasant or unpleasant. Just try to stay with it, not judge it, just experience the sounds in the room. We're going to do this for about a minute. Now for the next minute or so, try to be aware of your breathing. You'll notice that your chest rises and falls. Pay attention to your in-breath and out-breath. Try to compare it, if you can, to waves on an ocean. You have a wave that crests and crashes, a breathing that goes in and out. Pay attention to the rising and falling of your chest. You may find that your mind goes elsewhere, maybe to what you have to do after this talk or what you're going to be doing tomorrow, the shopping list, any number of other things. And if you have those thoughts, don't chase them away, just observe them non-judgmentally. Just try to experience breathing for a little bit longer. Okay, for the next 60 seconds, shift your attention to your whole body. This time, notice your posture. Notice the sensations in different parts of your body. Notice the feeling of your feet against the floor. Still pay attention to your breathing, in and out. But feel maybe the tightness in your feet or stomach. Maybe in your shoulders. Just be aware of different sensations in your body as you breathe in and out. And in a moment, we're going to end the exercise and come back to the room, but stay with your breathing for a few more minutes, for a few more seconds. Stay with the in-breath, the out-breath. And chances are, when you open your eyes, you're going to feel a little more relaxed. So when I count to 5, I'd like everybody to open up your eyes slowly. 1, 2, 3, 4, 5. Now everybody take a deep breath. How many of you are aware of being a little more relaxed right now? Okay. This kind of exercise that you've just had a taste of, some people really make this a daily routine of meditating in the morning. It's hard to find the time. It's hard to justify to yourself. I have, on top of all my other responsibilities, I've got to do a half hour or an hour of meditation. But people who do it definitely report that their stress levels drop. There's quite a bit of evidence that the immunological functioning improves, people's health gets better. And relevant to bipolar disorder, if you're a caregiver, there's nothing better if you've been in a high tension situation, either with your loved one or the mental health system or whoever, to go off to your room and do a brief meditation. Up on the screen is a reference for a book you can get hold of, actually that's, the name of the book is The Mindful Way Through Depression. This is another one. But in A Mindful Way Through Depression, you can get a DVD that gives instructions. There are plenty of mindfulness websites. So this is one thing we try to encourage people to do to manage their stress levels. We'll come back to this a little later. Let's talk about sleeping and waking. Just about any health plan that you are engaged in is going to say something about the importance of regular sleep. And more we're recognizing that mental health is related to sleep disturbance. And that people who have mood disorders often have chaotic, irregular sleep patterns. Sometimes it's under their control and sometimes it's not. One of the very first things we do is work with people on what is their sleep-wake routine. And it turns out it's not so important what time you go to bed. It's that it's the same time every night and that you get enough hours of sleep. So it's not particularly important whether you go to bed at 11 and wake up at 7 or if you go to bed at 1 and wake up at 9. Some people do better with those arrangements. But it is important not to be going to bed at 10 and then 2 and then 1 and then 3. My daughter, when she was a teenager, used to sleep with her cell phone underneath her pillow. And she'd get texted and called by her friends in the middle of the night who were also up all night. And believe me, it had an effect on her mood. It does for most people. We encourage people not to sleep binge on weekends because it tends to throw off sleep during the week, even though it's tempting to sleep in on Saturday or Sunday, to try to avoid sleeping in 2, 3, 4 hours and getting up at noon when you have to get up at 6 the next day. Lots of over-the-counter medications are secretly going to keep you up at night. Sudafed is the most famous one, but certainly coffee, Jolt, colas, and so forth, anything with lots of sugar in it. People sometimes do their workout routines right before they go to bed, when in fact exercise keeps you up. So we ask people to move their exercise routine earlier. When you're traveling, you try to keep a normal sleep-wake routines. If you're a person who needs to travel a lot for your work, you have to try to get back on a regular routine as quickly as possible. This is one of the things that people can track on a daily basis. How is my mood? How is my sleep? How much are the two of them interfering with each other? Okay, let's talk about medications for a moment. This is often the most emotional topic for people, is taking medications and which ones. This is only a partial list of what medications we have for bipolar disorder. The plus signs indicate whether that drug has been found by the FDA, the Food and Drug Administration, to be effective for mania, for mixed episodes, which are episodes where people are high and low at the same time, depressed episodes, and what we call maintenance treatment. Do they prevent recurrences in people who are well? One of the things we know about lithium is that not only does it bring people down from highs, and to some extent bring people up from lows, it also prevents the occurrence of future episodes in people who are vulnerable. Lithium has the best evidence, but that's because it's been around the longest. We also have lamotrigine or Lamictal, which seems to be better for depression, and we often use it as an antidepressant. We have all the atypical antipsychotics like quetiapine, or better known as Seroquel or Abilify or Zyprexa or Risperdal. Those do have a pretty good effect on mania and sometimes on depression. The problem with all of them, of course, is they cause weight gain, Zyprexa being the worst of all those. But they can be adjusted, dosages can be adjusted, one can be substituted for another. Now, I'm not a psychiatrist, but I will tell you that the issue of taking medications, it comes up all the time in my work in psychotherapy. People have a love-hate relationship with medications when they have bipolar disorder. On the one hand, it controls their mood, helps them function, helps them relate better to people, but at the same time, people feel like their emotions have been taken away or their creativity has been stolen from them, which are legitimate feelings to have. What I tell people, well, first I think it's a given that people are more likely to take medications if they're approached in a humanitarian way with information, when they're told what it is these medications do, why you're taking 2 or 3 or 4 of them instead of 1 or 2. Why am I taking an antipsychotic? I thought that was for schizophrenia. Why am I taking an antidepressant? I don't feel depressed. All that information is sometimes withheld, and it's very important for doctors to be giving you that information, to let you know that if your medications aren't working, you can have a discussion about changing them, changing the dosages, substituting one for another, taking one away. There are various ways to adjust a medication regimen. It should be an ongoing dialogue between your doctor and yourself. Many people don't know they can have that conversation.